Hello and welcome to this special edition of To The Point. My guest this week is Frederika Meijer. Welcome to the program, ma'am. It's a pleasure having you on Rajya Sabha television. First of all, let me start with, you've been in India 10 years now and you've been heading this particular job for 1 year. Tell us about your experience in India, working in India, in a country like India, a developing country like India. How has your experience been?
Well, first of all, I can't find a more interesting country like India and that's why I've stayed here for the last 10 years. And it has always been my dream to work in India to make a change for the mothers and the children of India. Once, a long time ago, I traveled with my mother through India, and together we had the dream to try to make a change for the people in India. So that's why I've taken this job, and I think in this job I can do something.
Right, right. So your dream did come true and you did come to India to work in your line of work, of course. Let's talk about the new report that UNFPA has come out with on maternal mortality. Walk us through the report. What are the salient features? What new findings did we find in that report? And any particular, one particular finding that you think is most important and the world should know about it?
Well, this report is a joint report from UNFPA, WHO, World Bank and UNICEF. And what we looked at is the trends over the last 10 years with regard to maternal mortality. We have seen good progress in reducing maternal mortality. It has gone down 47%. However, in India it has gone down 38%, which is good news, but on the other hand there is still a lot to be done. If we want to achieve MDG 5 worldwide, and which is...
That is the Millennium Development Goals that the Secretary General had talked about.
Exactly, sorry. The Millennium Development Goals with regard to maternal mortality, we have to reach in India 139 per 100,000 in the year 2015. If we continue in this speed which we are currently doing, we might be able to achieve it.
Right.
So we really need to speed up in India, which is not only the figure of maternal mortality, but also the size of the population which is contributing.
Which must be a challenge, I presume. Having a large country like India with such a population, it must be very tough to actually reach all those villages and the towns that are inaccessible otherwise.
Correct, yes. Yes, India of course is a huge population and it is difficult for the government to reach all the communities. But I must say with the National Rural Health Mission and the Reproductive Child Health 2 program, the government have made enormous efforts to improve institutional deliveries. And these institutional deliveries have contributed quite tremendous to reducing maternal mortality. However, we still see pockets of where there is high maternal mortality, for example in Assam, Rajasthan, Bihar. These are the states who really have to catch up. The southern states like Kerala, Tamil Nadu, they are really on track, but their health system is also stronger. So if we are able to really improve on those states who are lagging behind, where we improve the services in the primary health sector, where we bring together the services of the anesthesiast and so on, where all the doctors are available for time of delivery, then we can make a good progress.
That's a very good point. I wanted to ask you this. You mentioned Rajasthan and Assam and all these other states, and Kerala and Tamil Nadu doing better than these states. Why do you think that is? Do you think because the level of education in those states is slightly better than, say, Rajasthan and Assam? Do you think that's one of the reasons why those rates are high in those states?
Education is indeed better, but I mean that's not the only reason. If we look at a state like Assam, they have a lot of geographical challenges as well. I mean, we have far off villages, you have to cross the waters, you have to cross the mountains to reach all the women. With the module in place of the Ashas who are reaching out to the villages, we can make a huge improvement. If these Ashas are able to convince the women to go in time to the health service or the sub-centers to check up whether their baby is healthy, whether they themselves are healthy, whether they need to go to health clinics for delivery, that can reduce a lot. So we have to make sure that the different range of services is available, that blood is available when they have to go for a cesarean, that anesthesist is available when they need to have so, and whether the doctors and the A&Ms have the right set of skills to provide for complicated deliveries.
Let's talk about what the government is doing, the Indian government, in respect to maternal mortality and getting it down. You obviously work closely with the government and you have interactions with them on a regular basis. Would you say that they've done enough to bring down the rate of maternal mortality, and the programs and the initiatives and the schemes that they've launched? Do you think that's enough, or does the government need to step up its act and do more?
Well, the government has done a lot. I mean, there's always scope to do more, and the system is still not perfect. If the system would have been perfect, the maternal mortality would be down to close to what the Western countries have. So there's always scope to do more. However, I think with the universal health coverage, where a woman can have for the first 30 days free services in the clinic when she is going to deliver in the clinic, these are the kind of schemes which are very helpful to reduce maternal mortality. Also with the JSY, where she gets compensation when she's going to deliver in a hospital. These are schemes which are helping the woman well to convince her to go to the clinic. Where there's maybe a lack is they need to look at maternal death reviews. So why are the women who are going to the clinics and so on, why are they still dying?
Right.
What are the problems in the particular districts? What are the problems in the particular block? And only if the government knows what are the particular problems in those blocks, in those districts, then they can take corrective actions. So now it's maybe not a matter to have the same measures all over the board, but you have to look at where are the pockets of maternal mortality and what do we need to do over there. Sometimes it's a lack of transport, although in the programs now there's also transport available for women to go to and from the health facility, but not everywhere. So if that's the obstacle, let's correct on that one. If the blood provision is the obstacle, let's provide for that one better. So it's really system strengthening, but with regard to certain blocks, with regard to certain districts.
And those obviously will happen over time, and it doesn't happen overnight, obviously. Let's talk about your experience in other countries. You mentioned earlier that you had worked in Mexico as well. Compare that to working in India. Both are developing countries, both are huge populations as well, and huge challenges as well. How does it compare working in a country like, say, Mexico? How is India different?
Mexico is facing quite similar problems as India. However, the health system in Mexico is better. Also, the per capita income is higher in Mexico.
Is that because they have better medical infrastructure? Is that why the medical system is better there?
Well, what I said, they have more per capita income, so the country is richer than India. Their medical system from bottom to top is slightly stronger. However, if I would compare it to Kerala, I would say it's not stronger, it's the same. Right. But what they do specifically in Mexico is, for example, they look at the tribal population, the tribal boys, the tribal girls, and how can they improve on knowledge with regard to reproductive health, especially looking at what do the girls need to know to stay in school, not to marry off early, not to go in, well, not to have sex at too early age, all those kind of things. Exactly, all those kind of things. So it's basically how can they improve on the information they need to have to grown up as a responsible adult. Right.
At that point, Frederika, we take a small break. We'll come back and we'll talk about adolescent girls in India, young girls and young mothers, and how we can prevent maternal mortality in that cases. Don't go anywhere, stay tuned. We'll have more with Frederika Meijer right after this break. Welcome back. We're still in conversation with Frederika Meijer, Executive Director of the UNFPA in India. Ma'am, we were talking a bit about adolescent girls in India. Given the fact that the girl child in India has faced terrible ills for a very long time because of the system that exists in a country, in such a huge country like India, where do you see the young girl, adolescent mothers, teenage mothers, having the pregnancies for the first time? What is the situation there in India especially? How bad is it? How good is it? You, of course, will shed some light on it.
In India, quite a lot of young women, they are getting the first child too early. And we see, particularly in the pockets where there is a high maternal mortality, it goes very well together with, in the lowest quintile of wealth, the poor women. They go earlier for pregnancies, they marry earlier, they drop out of school earlier, they go for the first child earlier. And the chance that they die in childbirth is far higher. If a woman gets her first baby before the age of 15, her chance of dying is 5 times higher as normal. So it's very important that we keep the girls in school, that we make the education for the girls relevant. So if they even complete secondary education, the maternal mortality will go down tremendously. If we are also allowing the girl to space between the first and the second child, because the younger the girl is, if she has herself to feed and grow, if she has her baby to feed and grow, the chance that she will not have a good delivery is higher. So let's make sure that she is matured, then she will have a far healthier baby. The baby has a far bigger chance she will reach the age of 2, and she has a far better chance that she will have a different life with less poverty than her mother and her father.
Has that message, this message that girls should delay their first pregnancies, and if you're really, really young, you shouldn't have a child, has that message sort of seeped in to, say, pockets that concern you, especially, say, states like you mentioned, Rajasthan and Assam? Has that message sort of started seeping in, or is it still very difficult?
It is seeping in. I mean, of course, it's not an easy message to transfer, but we have to work with the communities. We have to talk with the elders of these girls, why it is so important to keep this girl in school. It's not that the girl is only working in a household and that she doesn't need education for the household. Even to run a household very well, it's far better if you have enough education to understand what is healthy food for your children, why you have to have clean drinking water, why the children should not get sick, if they have diarrhea, what to do, and so on. So even if the woman stays at home, it's far better if she has a certain degree of education. So keeping her in school, educating her, which will empower her for the future, which you have a bigger chance to make her economical productive, which is better for the economy of India.
Right. You mentioned a particular program that you have initiated and started for the young girl child. Tell us a bit about that. What is it called in Hindi as well?
Well, it's a very difficult word in Hindi. It's called Sapna Ko Chali Chuni, and it's about chasing my dreams. It's a group of girls together with an implementing partner where they are chasing their aspirations. So what we do, we empower the girls to, first of all, express themselves, and then making sure that they know what they want in life. And these are college girls, by the way. These are not the poorest of the poor. And for them it's very important, for example, how they have to deal with eve teasing. That they should not feel guilty if eve teasing is taking place. It's not their fault, it's the fault of their surrounding. I mean, no one has the right to go for eve teasing. So what should a girl do? So this program is learning a girl what she should do if she is confronted with eve teasing and all those kind of things. So it's empowering the girl, it's making her feeling good, it gives her self-worthiness, and also that she understands why it's better to have her first child after the age of 20.
Absolutely, and it sounds like a very interesting and important initiative. Going slightly away from this, going to the international scenario, you obviously worked in other countries as well, and you have a wealth of experience in dealing with maternal mortality. Where does maternal mortality stand, say, if you look apart from India, other countries that might not be showing the progress that the UNFPA would want? What are the other countries that are lagging behind, and what are the countries that are really doing well?
Countries which are lagging behind is very much in Sub-Saharan Africa. These are quite often countries in conflict, where the services are not available, where blood is not available. All the list of services which I've mentioned before, they are not available in a comprehensive package. Health providers are not available, etc., etc. Countries which are doing better, if we look at, for example, our neighboring country, Bangladesh, they invest a lot on midwifery skills. So you don't, if you have a normal delivery, you don't need to always go for an institutional delivery if you have a well-trained service provider and a midwifery skill. So a midwife could be a very good initiative to bring down maternal mortality. It has shown clear results in some of the countries, for example in Bangladesh.
Right. Any similar sort of initiatives that we can try and implement in India? Because if it worked in Bangladesh, it could definitely work in India.
It has started in India. In India we are working very hard with the government to upscale the midwifery skills of the A&M. We don't have a special midwifery cadre in India, but what we try to do is to improve the skills of the A&M with regard to midwifery. So the government has also said that they want to put 2 A&Ms in the sub-centers, and this will contribute a lot to have deliveries taking place in the sub-centers in the community. The closer the woman stays with her community, in fact, would be better.
You mentioned that some Western countries have a far better rate and it's come down a lot. Do you attribute that to just the level of education, or do you also consider the kind of society that the girls live in? Is that a factor as well in developing countries?
It has to do also with the empowerment of women. I mean, you see a strong relationship with the status of women and the status of maternal mortality. The better a woman is empowered, the better access she has to education, to economic possibilities, the less a chance there is that she goes for early marriage or for early childbirth. So there is a strong relation, and you
Right.
see also the stronger the status of women is, the better and the more productive a country is.
Right. Since you worked in India and you obviously traveled a lot in and around India, would you say that there is one particular state or three particular states where the problem is more compounded than, say, the other states? I'm not just talking about maternal mortality, I'm also talking about early marriage, child marriage, and the repression of women. Do you find that particular states that might be sort of problem areas?
Problem area, I would further say it's areas with bigger challenges than others. There are some districts which are further away from the center, which there is still going together of traditional values, less schooling, less influence of all kind of other.
Would you like to name a particular area at this point?
I can't single out one district or one state.
But there are many around India.
There are some pockets, but I mean, even within districts, you have better off pockets. Better off parts. For example, if you go into the very inner areas of where there is a lot of bushes, if you see there a missionary hospital, then that particular area is doing better. Because there are doctors, there are nurses who are committed to make a change in the community.
Right.
They interact a lot with the community on what should they do to improve the overall health of the community. You see also places where a district collector has a lot of interest in bringing down the health burden of his district. So it depends very much on how much interest particular people take in improving the health of their area.
Hold that thought. We'll talk a bit more about maternal mortality and what it means to the world as well. More with Frederika Meijer after the short break. Stay tuned. Welcome back. We're still in conversation with Frederika Meijer. In this segment, I'd like to talk about the global scenario, especially on maternal mortality. It's been a problem for years, for decades in fact, and a lot of the arms of the UN have been working towards, especially towards taking care of women and young women around the world. Where do you see the kind of where do you see maternal mortality going? Do you think it's going to stick around forever? Is it one of those challenges that takes years to overcome, and can we eradicate maternal mortality from the face of this earth?
It depends a lot of the political will at the central level, at the state level. Today we have seen a very good initiative of Chief Minister Gogoi, who wants to bring down maternal mortality in Assam. And I guess when a lot of leaders are taking that leadership in bringing down maternal mortality, it can make a huge change. And it's not something, it's not a choice as such. I mean, we have to do it. If we want to make India a prosperous country, it's better that we invest in maternal mortality. Imagine that you have a family of 2 or 3 children and the mother dies, then the father stays along with the other 2 children. The chance that the family is falling back into poverty is far higher than you save the mother. So I mean, investing in maternal health and bringing down maternal mortality is investment in the country as a whole. It goes along with investment in education, as I said before. It goes together with investing in economic opportunities for women. So working on women empowerment, bringing down maternal mortality will benefit the society as a whole.
Right. Another problem that we've seen over the years, and you must have seen as well, are stunted growth in children as well. Explain to us and our viewers, why does that happen? What are the reasons behind babies growing with stunted growth? Is it to do with malnutrition, or is it a little more complicated than that?
Well, as I said before, if women get a child too young, they have to feed both themselves and the child. So whether then a child gets born already with a too low birth weight initially. If the child is already behind by the day she is born, then it takes a long time before she's catching up. We've also seen in the lowest quintile of the poorest quintile of the population, when a woman is not well educated, she doesn't know exactly on what is good for her baby to feed, what kind of vegetables, what kind of vitamins should the baby have to grow up well. So these are all interrelated social determinants which are defining whether a young girl will grow up to a matured grown up.
Right. We talked about Mexico and India and your different experiences there. Given the fact that you worked in and out of India for about 10 years now, help us understand what sort of countries can India learn from? Similar countries with similar demographic divides and similar population, similar problems and challenges. Are there any countries out there that have managed to overcome these difficulties and challenges that India perhaps could learn from?
First of all, India can learn from itself. If you're looking at Kerala, I mean,
that's a state model that we should
Kerala has a lot to show, as Tamil Nadu has also a lot to show. What they have well in place is, for example, the management information systems, that you know whether certain contraceptives, etc., are available at the sub-centers, at the primary healthcare centers, etc. So you have to need the systems in place, and also to look whether the supplies are meeting the demands in a certain district or whatever. Other countries where India could learn from, I mean, India has it all. We know how we can bring down maternal mortality. It's not a matter of lack of knowledge.
It's a matter of implementation.
It's a matter of implementation, and it's a matter of political will. How much do we want to invest in maternal mortality? What is more important, schooling or maternal mortality, or can we bring the two together?
You mentioned Mr. Gogoi's initiative and how he is trying to bring down maternal mortality in his state. Any other leaders or any other tall leaders across the political spectrum do you see that have tried similar efforts or want to do similar efforts? Have you spoken with any of them?
Well, what we see is that several leaders in India are taking initiatives on women empowerment. If you look at Bihar, the chief minister has given bicycles to all the girls. That's an important initiative to keep the girls in school. And so they are not dropping out, they are not marrying too early, they are not having their child too early. We also see in Rajasthan, they also take a lot of initiatives in women empowerment. So if we bring all these initiatives together, I can say India is on the right way. But it can go a little bit faster. And so we have to work with men and women to bring more prosperity.
What about funding, Frederika? Is funding that important as implementation? Is the government, like you mentioned before, government is doing a lot, but has to do a little more. But do you face the problem of funding at times? Because obviously funds do come in from international agencies as well. Like you mentioned, there's the WHO, there's the World Bank. But do you think funding could increase a bit, and that would perhaps slightly help you a little more in your efforts?
Well, we have seen in the next 12-year plan, they are going to double the funding in the health sector.
And that's a good initiative by the Prime Minister.
It's an excellent initiative, and so you don't need funding from external sources. You have the private sector. I mean, you have a lot of rich people in India. If they can bring more funding into the health sector, if they take more responsibility for the development of our own country, it's more a matter of distribution. So if we distribute the funds well, the health sector can develop well.
And you're talking about the private health sector as well, which might just do these things pro bono if they want?
I was first talking about the corporates. The corporates bringing in more social corporate responsibility funds. The government will make use of the private providers, sourcing in, sourcing out, bringing private doctors into the public health sector so that more doctors are available to provide the services which are needed at the grassroots.
Right. There's one little thing that I want to discuss, accountability in these projects. Obviously has been an issue in every other sector, is an issue as well. But do you think accountability and transparency have been an issue or could be an issue in India while executing these projects?
Well, accountability goes across the board. I mean, it is at a grassroots level, it's accountability of the communities, it's accountability of the PRIs, but it's also accountability of the Rajya Sabha members who should look at the programs and ask questions whether the funds are reaching there where they should reach. And then having, what I said before, having the systems in place, if you are delivering a certain medicine to a subcenter, is the medicine reaching there and is it given out to the patient? So you need to have the systems all over the place which are functional. Now with technology, I mean with mobile phones and everything, you can sharpen the accountability. And so people are entitled to certain things. People are entitled to contraceptives if they want. So let's make sure they get what they are entitled to.
Is there a message that you would like to give out through the medium of Rajya Sabha television and to the point to the political class in India? Because you mentioned political will is extremely important. Just to wrap our show up, if there would be a message to the political class on the question of political will to reduce maternal mortality, what would it be?
Well, let's make sure we deliver a world where every pregnancy is wanted, every childbirth is safe, and the young people can go for their aspirations.
Absolutely. Thank you so much, Frederika Meijer, for joining us. That was Frederika Meijer, Executive Director of the UNFPA in India. of course, saying that funding and everything is available. The government is taking initiatives. What is needed is keep the girl child in school, delay the first pregnancies as well, and accountability, of course, is important. That's all the time we have from To The Point this week. Till next time, thank you and goodbye.